Okay, Zach, the first thing I need you to find on your patient is a lumbosacral junction.
Awesome, and if you don't mind laying with your face down, right, go and tuck and drape your brother.
Lumbosacral junction.
Lumbosacral junction. So I'm going to start at the inferior aspect of the ribs. I'm going to scissor hand down to the iliac crest. I'm actually going to windshield wiper in and right on that PSIS, a little lower, right there. And I'm actually now I'm going to windshield wiper in. And bisect that line. It's going to be right on S2. And I'm going to check that with, I'm going to go soft tissue, bony resistance, and then soft tissue, bony resistance. And right there should be L5.
Okay, you're looking for the
Lumbosacral junction, excuse me. So I'm going to start swing it in, bisect that line. That's S2 right there. And then to verify that will be soft tissue, and then right in there.
Okay, so you're palpating soft tissue all the way up?
Yes, and in the lumbosacral junction will be soft tissue, and then right at the top will be L5 at bone resistance.
Okay. Next, using a landmark, palpate the right transverse process of T4.
Right
Using a
transverse
landmark.
process of T4, landmark. Awesome, man. So if you don't mind going to the Sphinx formation, that's just going to be right up on your elbow, and I'm going to get control of your head. You can just let it go, and I'm going to put my sif on the most prominent aspect of vertebral, and I'm going to go push you into extension, and I'm verify that that is V7. So I'm going to have you go right back down, brother. And you said, what was the structure?
Using a landmark, palpate the right transverse process of T4.
T4. So this is C7, T1, T2, T3, T4. So, and then in that, I'm going to go up 2 inner spinous spaces, and then out 1 inch, and then right there, I'm going to put my episternal notch over that, and I'm going to wag it. I'm going to feel that movement of the transverse process, right transverse process of T4.
Okay, next, palpate the left articular process of C4. Left articular process of C4.
Awesome. I'm going to drape you back up, man, and if you don't mind sitting up for me, brother. Okay, I'm just going to sit right on the edge over here facing that direction. And sorry, could you repeat that?
Left articular process of C4.
Awesome. So, I'm going to start as EOP. I'm going to get control of his head. I'm going to move down to C2, C3, and C4. I'm going to redo that. EOP down. So there it is. C2, C3, C4. That's what I get. And I'm going to get the thumb and my sif, and I'm going to go about 3/4 to an inch out. Get rid of the soft tissue out of the way and articulate posteriorly, anteriorly, and I'm looking for bony resistance with that.
Okay, next, locate the sternoclavicular joint.
Sternoclavicular joint. Awesome. So if you don't mind just swinging over here, brother. You have a right or left or anything?
Left sternoclavicular joint.
Left. So actually I'm going to swing all the way over there. I'm sorry. Right here, buddy. Thank you.
Left sternoclavicular joint.
Awesome. So I'm going to actually tuck under you. I'm going to get you a little more comfortable. I'm going to get my sif and my if. Right, my sif is going to be on the manubrium or the episternal notch, and my if is going to be right on the clavicular head. And I'm going to actually get his arm, and I'm going to move up superiorly. I'm going to feel the motion of the clavicle articulating, and the movement is the confirmation of that.
Okay, your last structure is the right navicular bone. Right navicular bone.
Awesome, man. If you just want to lay back on your back, that would be perfect, dude. Right
navicular bone.
Awesome. So that is going to be a lateral structure. So I'm going to rotate that lateral malleolus, and I'm going to go directly inferior to that, and that's going to be the body of the talus. And if I go inferior and more medially, it's going to be right on that body of the talus. And so what I'm going to do from there is go directly distally, and I'm going to be right on the navicular bone, and And so what you're going to do is swing around, get some good traction on there, and I'm going to move it inferiorly and superiorly, and the motion is confirmation on that. And the vehicular run is pretty important because it is attachment point for spring movement.